Welcome to Megabucks Radio. Conversations with successful entrepreneurs, sharing their tips and strategies for success. Real-world ideas that can put megabucks in your bank account. Here's your host, Nina Hirschberger.
Hello there, and welcome to today's show. Pain is an inevitable part of our lives. It doesn't matter what age. Being in pain can be debilitating for anybody. And it might be as simple as a nuisance pain or maybe even severe as back pain that just leaves you in bed or unable to do things. My guest today is Dr. Derek Taylor. He is a chiropractor with two offices, one in Torrance, California, and one in Palm Beach Gardens in the state of Florida. So he's worked with thousands and thousands of clients, and what makes him so unique is he doesn't just treat the pain, he looks for the root cause. So Dr. Taylor, welcome to today's show.
Thank you for having me on your program. I appreciate it.
Oh, my pleasure. So let's start out. First of all, let's talk about the advantages and benefits of working with a chiropractor.
Yes. Well, there's a ton of benefits of working with a chiropractor. I always tell patients this is your first portal of entry. If you have a health issue that you've been dealing with, see your chiropractor first. They can assess and see what's going on here with you. And if it's something more serious that requires immediate medical attention, they will refer you out and get you on the right path that way. If it's something more simpler to fix that can be done through chiropractic and natural means, then the patient can benefit by having their problem resolved without the use of drugs, injections, or surgery.
So do you think the people, do they come to you first, or do they not even think about coming to a chiropractor?
Well, our patients that have been with us for many years, that's the first thing they always do. They typically come to us first, unless, of course, they know that if something requires immediate medical attention or that is out of our scope of practice, they'll go to the ER or some type of emergency specialist. But if they have an issue that they are dealing with, they've seen the power of chiropractic and they've seen what happens when the body gets in balance, and they've seen miracles in their own health radically shift and symptoms improve, and conditions that they didn't think could be resolved with chiropractic resolved just by getting the body back into balance. And so they understand the confidence that they have in their own body's ability to heal itself. And so they'll often come to our office to get those conditions addressed, even if they are not under the category of something that typically somebody would see for a chiropractor.
Well, you and I chatted before we even began this show, and I know you're a little different than, quote, the normal chiropractor. So tell me, what makes you so different? Well,
I started out with I didn't know anything about chiropractic. I was first exposed to chiropractic when I was in high school. I played high school football, and I injured my back so bad I couldn't even walk. So I went to a chiropractor, and actually he made me worse. And so I was scared, and I was telling everybody, never see a chiropractor, they'll make your back worse. But I was so desperate, nothing was helping. I saw a different chiropractor who used an innovative, different approach, and I had a miraculous recovery, and that inspired me to become a chiropractor. And so I got into chiropractic, jumped in, both feet, dived in head first. I wanted to be the best chiropractor I could be. In high school, I was a C student. I played football as a jock, hung out with, the party crowd. And so I was a 2.0 GPA. But when I got into college and decided I wanted to become a chiropractor, I just put every effort into it. I became a straight A student, graduated with the dean's list. I entered chiropractic school, and my class voted me most likely to succeed. I wanted to be the Team Rams doctor. And I graduated from chiropractic school thinking that I knew everything and I could fix everybody under the sun, until I got into private practice. And then a rude awakening occurred that I thought I was going to be able to fix everybody, but not everybody was being fixed. And in fact, there were some people that were getting worse because I was just using the stuff that I learned in chiropractic school. I didn't really know what I was doing per se, or really how to fix people's issues. I was just doing what I was taught. And is when I started my own practice, and I had to feed my family and my newborn son that came into the world, and we were struggling, that I realized that if I was getting people worse, I was not going to have a business. And so I went on this rampage of taking continuing education courses and seminars and following docs around the country and learning from top docs around the world in regards to how to get to the root cause of people's pain and problems. And over the past 30 years, I've taken the best of these different seminars and doctors and techniques, and I've kind of picked and choose the different aspects that I liked, and I threw out the things that I didn't like. And I've developed the Taylor method, which is a unique proprietary method of discovering the root cause of the pain and the problem. And then we've combined that with a state-of-the-art, leading, cutting-edge technology that is around different parts of the world as well. And combining that specialized knowledge with this specialized technology has afforded us to get really exceptional results that you can't find anywhere else except in Los Angeles, California area, or the West Palm Beach area in Florida.
So if you go back to you're in high school and your back hurting so badly, what do you think that chiropractor was doing that made it even worse?
You know, he was just doing your basic stuff that you learn in school. You know, he was doing the adjustments and adjusting me and trying to take the pressure off the nerve, but that really wasn't the issue. And so the other chiropractor, he looked a little deeper. He worked on areas that the other chiropractor was not working, and then I had a miraculous recovery. And so that's what made the difference. You know, just looking a little bit deeper, trying to understand, why does this person have the pain in the first place, and not just you can't put everybody in a box and have them do the same technique and the same method of treatment. Sometimes you'll get lucky, and for the most part, a lot of people will be helped, but then there's people that won't be helped because that's really not the issue. So you have to have a targeted, specific approach to every person that comes in, using a customized treatment that helps you get the best results.
So give me an example, something, a recent patient that's come in. Give me an example of what you've done with them.
Well, just yesterday, I'm just thinking right on top of my head. So a gentleman came in. He's been seeing me. He was going to give up playing golf. His back was so bad that for years he was bound up, and he was referred to me by the naturopathic doctor that we both knew. And after a few treatments under his belt, now he's playing 18 holes of golf. He's doing much better. But over the past weekend, he had a little bit of a setback, and we discovered that he was eating too much fruit, which was causing his pancreas to be stressed and overtaxed, which caused the left side of his neck to freeze up, which bound up and stiffened his lower back on the left. So in his case, to get to the root cause, we had to take care of the neck. But the reason why the neck was bothered, because he was eating too much fruit, was putting too much stress on his pancreas. So he's going to change that. We did a treatment in regards to the technology we used on him. He had an issue actually on the left and right side of his back. The left side responded to shockwave treatments on the left side of the neck. On the right side of his back, he needed a different treatment, laser, in order to clear that. We did both, and he felt amazing when he left. So, I mean, when we have so much technology in our office, and we have so many different tools that if one doesn't work or the body's not going to respond to it, we have to use something else. And that's what makes our office so unique, and what allows us to get such patients see great results, because we have so many different tools to choose from in order to help them achieve the results that they're desiring.
Now, in that particular guy, did you tell him to stop eating so much fruit?
Yeah, so he was eating like a banana before he played golf. Then he was eating an orange in the middle of it. So I said, you got to lose that kind of fruit. Stick to more blueberries and raspberries and lower glycemic type fruits that aren't going to create an issue for the pancreas. So yes, we gave them specific guidance. And then we also offer specific food testing. So somebody comes in, like I had a lady that came in last week. She's had this horrendous cough that she's not been able to get rid of. And I mean, it's just creating all kinds of issues. Can you imagine just having these coughing fits where you just can't stop coughing? And that just throws your neck, your back out. It creates other issues. It can cause hernias. It can cause all kinds of different issues due to the stresses. And she's a pretty clean eater, but she was eating food that was contributing to the inflammation and causing more phlegm on her lungs. And so she's come in, we've given her a specific program here. We food tested her and found out she was eating things that she thought was good for her, like oatmeal and, goat cheese and all these other things. But some of these things were creating more issues for them. So once again, people can be eating or doing something that they think is good for them. And it's, for the most part, it is good for people, but for that particular body type or for their particular constitution, they don't do well with that. And so to be super specific and to help them with that can make a world of a difference in clearing somebody's symptoms.
Well, and I think you talk about different stressors. So it's not just food, but you also talk about other ones too.
Yeah, the biggest stressor that I see in my office, Nina, is hidden adhesive scar tissue. So this is like the 90%er that we get in our office that is causing so many people's health problems that nobody really is addressing properly. So there are some doctors that focus more on working on muscles, and maybe they do ART or they do Grafton or they do some type of muscle work that affords them to get better results than your typical, let's say, standard physician's office that are just using basic manipulation and modalities. And so they'll get a little bit better. But what we do is we're able to identify exactly where the specific scar tissue is that is causing that person's symptoms or problems and address it and take care of it. And when you do, it makes amazing results. So what is scar tissue? It's your scar tissue forms in the soft tissues, muscles, connective tissue, fascia, ligaments, tendons from injuries, trauma, macro trauma such as whiplash from a car accident or a sports injury or a fall or some type of hit. And then there's micro trauma that occur just from activities of daily living, just sitting at a desk all day, looking down, texting, looking at your phone all day, working on a computer or at the station at your office that is not ergonomically set up properly. And so you create these micro tears in the muscles, fascia, ligaments, tendons, the soft tissues, and then that repairs by throwing down this fibrous tissue that connects the two pieces together, and then you have a shortened tissue, or muscle or ligament or tendon, and that pulls the bones out of place, that throws the body out of balance, that causes the nerves to be interfered with, that disrupts the flow of circulation and blood flow. And so that just creates these imbalances, which causes people's health issues. And it's not just pain or stiffness or tightness, but it's also weird symptoms like vertigo or tinnitus or dizziness or headaches or, just any symptom that you can imagine, because the nervous system is affected and the nervous system controls every cell, tissue, organ, and system of the body. So the nervous system runs the show. And so if you start to interfere with that, you can have the weirdest symptoms. And we've just seen like the most incredible conditions and results by getting the body back into balance when you start to clear out the scar tissue, things that you wouldn't imagine that could be taken care of just by getting the body back into balance. And so that hidden adhesive scar tissue is a huge cause of a lot of people's health conditions, and they don't even know it.
Okay, so that's really interesting. So if somebody comes to your office and tell me the process. What do they go through?
Well, first of all, we'll sit down with them and we offer free consultations for everybody at our office. And because people, they have questions. They want to know what's going on. They don't even know if we can help them or not. And I don't know if I can help them. We tell people right off the bat, if we can find the cause of the scar, we can find that hidden scar tissue or some other type of cause that's causing it, and we can identify it using the Taylor method, then we can help you. If we can't find it, there's sometimes people come in and they're so far gone that we can't find out what's causing the problem. And if I can't figure out if I don't know what's causing it, then we can't help them, and we just refer them someplace else. But so we offer the free consultation. We can answer all their questions that they have. They may have a ton of questions. And so we'll just answer those questions for them and just try to point them in the right direction. When somebody comes in their office, whether they're a patient or they're just checking us out for a free consult, we have their back. We want to get them in the right hands. And if it's not us, we want to get them in some other physician's hands or just refer them to the appropriate specialist. But if they do, let's say they decide they want to get an exam, we will then go and do a full-blown examination that's comprehensive. We'll ask questions about their condition. We'll really take the time to listen, and then we run a battery of different tests to figure out what's going on with them. We'll take a look at their feet. We'll do computerized measurement of that. We'll measure the joint in regards to the range of motion and flexibility and strength. We can check their autonomic nervous system. We can check their heart, how their heart is doing. Like I had someone that came in yesterday, and their heart was contributing to some of their issues. We can also look at we can do a computerized postural analysis to evaluate what's going on with them. We have surface EMG that can check the nerves that are coming out of the spine and seeing if the muscles are in spasm. And then we have the most state-of-the-art digital X-rays that can pick up the finest details with the least amount of radiation. Once I've gathered all of that data, I need some time to look it over. So they'll come back usually on another day. If they're coming from long distances or another state, we'll just have them, wait an hour or two, go get lunch and come back the same day. And then we'll explain to them what's going on, where the problem is coming from, what exactly is causing it, and then give them some options on what to do to correct it. We'll tell them exactly where the problem is coming from. If they want to, I'll tell them exactly where that scar tissue is if they want to. And if they want to fix it on their own, we'll just shake hands with them and say, this is, good luck to you. And they get the information they needed. But most people, they want us to help them with that condition, and we'll implement a game plan and strategy to help them correct that. And we'll let them know approximately how many visits it'll be, what the cost will be, and that we have different flexible payment options for people and financing as well. And then we'll lay out a game plan, and then we'll get to it and just see that we'll do our best to help them get the results that they desire.
Well, you know what? I've gone to a lot of chiropractors, and what you just described is nothing that I've ever experienced anywhere else. Mm-hmm. So obviously that passion to find those answers, find that anything that would help patients, obviously you've done that over the course of those 30 years.
Mm-hmm. Yeah, I mean, we do this just because we care. I mean, we really care about our patients. We want them to get the results. We understand that everybody needs chiropractic. Everybody needs chiropractic care, but we're not the chiropractor for everybody. So we don't accept every case that comes in, even if we can help them and we can help their issue. We may not accept their case just because for various reasons, maybe they're not fully committed to care, or there's a spouse that is, not in a line. We like to have the spouse there so they can understand as well what's going on, because we think that the two working together is going to be good. And so, but we are very selective of who we work with. Again, we're open to everybody, but if we don't feel like we're going to get the results that people are looking for, we'd rather not take them on as a client. And sometimes it's a timing issue. They're just not ready for it mentally, or they're still thinking that the surgery is going to solve their issue, or that pill that they're going to take from their medical doctor is going to help them. And if they're placing more confidence in that, or they want to go that route, by all means, we say, hey, pursue what you feel most comfortable with and what resonates with you. And when you're ready to come back here and you're ready to dive in both feet, because you got to be committed to this. It's clearing the scar tissue. It's not just, sometimes you can get a one and done and you can get great results with one treatment. But most often you got to get to there's layers of scar tissue. You take out the first layer and they feel a little bit better, and the second and the third. By the time you get to that bottom layer, however, how many there are, by the time you get to that bottom, their condition is 90% of the time going to be cleared and corrected. And so they have to understand that it's going to be a process, and I just want people to have full disclosure, knowing what they're getting into before they commit to care with us.
And so you have treated all sorts of different, things. I mean, I think about neuropathy. Neuropathy can be pain, or it can also be numbness. Is that right?
Correct. It's like pins and needles there on the feet. And in fact, I just had a guy come in from Ohio the other day. He had a calf pain. He's like in his early 70s. He tore his calf muscle at age 17 playing basketball, and he's been dealing with this calf issue since age 17. He's in his 70s now, right? As a result, he's developed neuropathy in his right foot. Well, we did a treatment for him, clearing out the scar tissue from that old injury in the calf. When we cleared that, that neuropathy pain was gone. I mean, he said, I can't believe this, but I have feeling back in my foot again. Now, I didn't even know about his neuropathy because he didn't even tell me about it. He was coming in for the calf. He said, my tingling in my foot is gone. And so, he didn't disclose that information to us, but just by clearing, that's another example. When you clear out scar tissue, sometimes you can just see things that, well, you didn't even anticipate that was going to be associated with it. But just it's funny how the body works. When you take pressure off of the body in the scar tissue, it's amazing the things that can happen. And by the way, he said to me, this is kind of, I don't even know if I should say this on a podcast or not, but I'm going to. But I mean, it's not anything wrong or anything, but he's married and all. He's got a great relationship with his wife. He said, I had the most amazing physical intimacy with my wife last night after you did that treatment on my leg. And I'm like, that scar tissue was a major blockage, not just for the foot and the calf, but for even the internal organs and his sexual reproductive organs. It had that kind of effect. I mean, you just never know what's going to happen when you clear out scar tissue and what people will tell you. And so I don't know if that's too much information on a podcast, but he just kind of said that. And so you just never know what to expect.
It's not too much information because you're in the business of helping people wherever they are. Right. So how, you say he's from Ohio, you're in Florida. How in the world did he find you?
Well, there's people that, in South Florida here, we have people that travel. This is a vacation destination, and so they can look online and they can find us that way. We just through word of mouth. We have people coming from word of mouth. With this particular individual, I already knew him, and so he was already a patient. I already had a relationship with him, and he's actually a friend of mine that I hadn't seen in a while. And so, but we do have people that come from just primarily from word of mouth. In fact, he told somebody else from Ohio, and they were down here, and that person that he knew came in yesterday. And so, it's just primarily is word of mouth is our primary means of people coming into our office. But then also people find us online or through our books or through other means. And so we welcome all. And I'm so glad to be here in South Florida because I think it's the greatest place on earth to practice. And nobody has a problem coming out here to visit us as well. They kill two birds with one stone. They get to see the beauty of South Florida and they get to come to the most. I think our office is exceptional in regards to providing an experience for people where they just feel like they're in the right place. We have the latest technology. It's comfortable. We have our comfort menu for people. We have organic treats and gluten-free treats and beverages, and our staff is so accommodating and amazing to handling our patients' needs, and so it's an easy thing to come to the office for many different reasons.
Let's talk about migraines, because there's a lot of people that suffer from migraines. I mean, first of all, what I should ask you is there any kind of pain or issue that when somebody walks in, if they're serious about getting some help, is there anything that you would say, no, I can't help because that one is too difficult? I think of migraines because I know doctors will say they can be caused by so many things that it's a very difficult one to take care of. So talk about migraines for a minute.
Yeah. Well, migraines, I mean, that's a tough one for a lot of doctors, and they don't like to deal with this because a lot of them just aren't getting to the root cause of it. Migraines can be caused by so many different things, but one of the big things that I see with migraines, other than diet and hormones and EMFs, is hidden adhesive scar tissue, believe it or not. I mean, I had a patient that came in this past week. She came in she's actually from Austin, Texas, and she's had migraines for 14 years. I mean, she's a young lady, but for the past 14 years, she's had migraines that have just been debilitating. In fact, she went to this clinic in Philadelphia. There's some headache clinic that's pretty famous, and I mean, a lot of people go to. She went there for 6 months, and they did all these oxygen therapy and all these different therapies. And she said that she got worse with each treatment. And because they weren't treating the scar tissue, they weren't treating the specific issue. She came to us. She came to us for a week after her first treatment. First of all, she was totally paranoid about getting treatment with me because she said, I hesitate even seeing you just because I've had treatments for my headaches, and I always felt worse afterwards. Well, we did a treatment on her, and her headache reduced greatly just after her first visit, her second more, her third. I think we had 3 treatments on her, and she was so elated with the results that she had seen just in that short period of time. She's coming back. She went back home to Austin to take care of some issues, and she's coming back. What's today? Tuesday. She's come back in 2 days and starting a treatment program with us, and going to stay here for a period of time until we get these migraines eradicated. I think we can completely eradicate them using the technology we use, but she had a lot of cranial misalignments and scar tissue, even in the scalp and in the head, that was causing a lot of her issues. And so we were using pressure wave, laser technology, PEMF, and all these different technology that we use, and she is so jazzed about getting treatment, and I think we're in a matter of time we're going to get these migraines completely eradicated. And she was saying, why don't you open up like a headache clinic? There's so many people that would be able to benefit. I just don't, because in regards to headaches, I probably should, because I think what we have to offer is so unique, and we've seen just amazing results with headaches. But part of the problem is, Nina, is that for so many of these headache sufferers, they live on these medications and Imatrix and these prescription medications. And I must say that clinic in Philadelphia, they did a great service for her by helping her to get off a lot of the medications and wean down on those, because that's half the battle right there. They're living on these medications, and these medications are actually perpetrating the issue and prolonging the problem, and their body never gets a chance to heal and to recover because of the medications that they're on. And so we're going to work towards getting her off all these medications. As I told her, let's work with your doctor. Let's work together. I can't, as a doctor of chiropractic, I can't tell somebody to get off meds. But what they do is when they get better, they take themselves off of the meds. Does that make sense? And we're going to be working with sense. We're going to be working with her doctor. I'll be more than happy to have a conversation with them, because the doctor doesn't. She's got a good doctor. She doesn't want her living on these meds either. But that's the only thing that they know. And so anyway, we look forward to the place of getting her, me working with her diet, getting her on right supplementations. We'll look at labs. We'll get her on proper protocol with regards to supplements and diet as well, and combined with the scar tissue work and the technology we use and getting the body back into balance, I see her having a complete 100% recovery. So we get great results with headaches.
Well, and what I heard you also say is that you work with their regular MD doctor. So yes, it's not like either or. Yeah. Both no. I always think that doctors should be working together. I always tell patients, hey, you want me to call your doctor? I'll have a conversation with them right now. I think doctors should be working together. No doctor can fix everything on a person. It should be a team approach for the benefit of the patient. But
unfortunately, what I've seen a lot is I've seen doctors become territorial. No, this is like, you should only be doing this treatment and shouldn't be doing anything else. And I always tell my patients, hey, this is my approach. This is what I have to offer. Go get another opinion. Go see your medical doctor. See what they have. And you just go with what resonates with you, right? If you're more prone to wanting to take a pill or take some medications and resolve it that way, then by all means, I tell people, go for that if that's what you want to do. But if it makes sense to you to get to the root cause of it and try something natural, then try this approach. But hey, why not get a couple of different people's opinion, and then you make the best decision what sounds best for you. I always like it when people have a choice, and then working together with the doctors together is even better when you can synergistically work together and helping resolve a patient's condition. It really should be about the patient, not about the doctor.
So let's go back to the headache, gal. So let's say you get all of the headache goes away. That pain or any pain, does it stay away, or is this an ongoing thing?
Yeah, if the headaches are primarily coming from the hidden adhesive scar tissue, once that scar tissue is clear, as long as she doesn't create new scar tissue, that headache stays free and clear. She may need periodic maintenance, maybe once a month or once every quarter, or once every 6 months, or even once a year if you're coming from long distances, based upon what your schedule affords. But that is the component, but the lifestyle really makes the biggest difference. Eating the right foods, staying away from the foods that are creating inflammation and triggering headaches, doing the lifestyle factors, reducing your EMF exposure, getting proper exercise and rest, and keep continuing to work at your health to take the stressors out, to keep your body balanced. You start to do that, and those headaches can be eradicated and stay that way, headache-free.
You've talked a couple of times about EMF stressors. Explain what that is.
Oh, boy. EMF stands for electromagnetic field frequencies. And what happens is you get that from cell phones, 5G towers, your computers, your printers, all your smart devices. I mean, we're surrounded by EMF stress. There's over 10,000 studies demonstrating the negative effects of EMS. And in fact, it's more known that EMS, it's more recognized than they understand now. The EMS there's more evidence that it causes harm than even cigarette smoking. I mean, this is bad stuff, and people are just in the dark about it because all the major wireless companies, they don't want you to know about this information. And so, but these are major hidden causes of headaches and other symptoms that people don't even associate with. People are sleeping with their phones, not on airplane mode, but just with their phones on Wi-Fi on, right next to their bed at night. And this is creating sleep disturbances and issues and other health issues. And they have no clue. Some people even fall asleep with their phones underneath their pillow. Can you imagine that? I mean, the issues that can create. But they're clueless to this, and they're not aware of it, and it's creating health issues for them. And their homes are just places where maybe they live in an apartment building or a townhouse where there's a lot of buildings surrounding them, and they're just bombarded with EMFs, and that just creates major health issues for them. And so it's important that you're aware of that, and you get educated on that and reduce your EMF exposure. There's things that you can do, like turning your Wi-Fi off at night, putting your plane on airplane mode, putting it in the other room. You can even go so far as turning off your circuit breaker at night, or you can go to the next measure and investing into harmonizing or blocking products that will help reduce the EMS in your home or office to help with your health. So that's a whole nother topic we can talk for hours about.
Yeah. Well, I'm looking at the time, and so Dr. Taylor, this has been fascinating. I do know you said you had a free initial exam if somebody wants to take you up on that. Sure. I think you've also just recently written a brand new book. Could somebody get a copy of that? So talk about if somebody wants to reach out to you, how would they do that?
Yeah, we have a new book called Ask Dr. Taylor, Yes, You Can Live Pain-Free. If they come to the office, in fact, for those listening onto the podcast, if they came to the office and did a consult with us, and there's no obligation that they would have to go to the next step to do an exam or evaluation. But if they just even sat down, I can answer their questions, and I'll give them a free copy of that book as a gift just for investing in their health and taking the time to try to dig deeper. And so how does that sound, Nina?
That sounds great. So how would they get a hold of you?
They can reach us at our office at 561-867-1020. They can either call that number or text it. It works either way. It's a landline, but we have texting ability through that. So they can text or call and set up a consultation. They can talk to either Joni or Jamie or Caitlin and set something up over the phone or through text, and I can sit down with them and I'll take as long as I need to answer all their questions that they have and offer this free consultation for your listeners.
So give me that phone number again.
Sure. It's 561-867-1020.
Okay, 561-867-1020. So, Dr. Taylor, thank you so much for being on today's podcast. I have a feeling that you're probably going to help a lot of people.
Oh, thanks, Nina. Well, you're helping a lot of people, too, by offering these amazing podcasts that are free to the public. And I think what you're doing is pretty fabulous itself and innovative. And thank you for the contribution you're making to the world.
Well, you're welcome. So until next time, this is Nina Hirschberger, and I'm going to challenge you guys all to give Dr. Taylor a call. I usually don't do these on this particular podcast, but he is so cutting edge, so unique that I asked him to be on my show. So again, the phone number is 561-867-1020. Until next time.
Thank you for listening to Megabucks Radio with Nina Hirschberger. To learn more about the resources mentioned on today's show or to listen to past episodes, visit megabucksradio.com.